Okay, good morning, everyone. And let's make a start now discussing Learning Outcome 2 today, which is related to understanding the changes in medicine that have brought about the concept which is accepted today, which is, doctor knows best. So this particular approach is what we're going to discuss today in most of the learning outcome. And there are three assessment criteria wherein we are looking at basically summarizing who are the key people who have contributed to the development of modern medicine. And we'll be looking at works which have been carried out by Lister, Joseph Lister, and Louis Pasteur. In the second assessment criterion, we'll be looking at the invention of key medical implements and the advances in, equipment that we use today, specifically in the field of medicine. So we'll be looking at a catalog, which I will share with you, which basically shows how, inventions have happened over the years in terms of decades and centuries, and how we see some of these instruments becoming, pretty much day-to-day usage instruments from a point of view of, doctors or practitioners essentially looking at treating patients. We're also going to be looking at discussing, basically the task 2.3 is basically looking at advanced discussion to analyze that how the domain in terms of patient knows best has moved to doctor knows best over the years, and how this has impacted, when we look at, treatments being provided to patients, across the globe. So this particular learning outcome will also be looking at focused on, reading. As you can see, the key descriptor is understand. So there are some handouts that I've made available on the Moodle, which I'll show you in a bit during the session. And these are the ones that you need to be looking at reading in order to, go through and understand some of the background and history with regards to the concept doctor knows best, and obviously the key people or individuals whose work, has led to the creation of what we use today as modern medicine. So let's start off our discussions with looking at, a few slides. These few slides that I've got, I'm going to be elaborating them. I've only got a few slides today, but what I'm going to be doing is discussing a lot of it primarily from a point of view of, verbal discussion, and obviously showing you some bits of it through a video. Now, we've discussed yesterday the two concepts or words which will come across frequently. And, if you recall, we discussed what is medicine, and we also discussed, what is health. So we looked at the definitions of, health as per the World Health Organization. And, in terms of in general, when we look at the word medicine, we discussed things like it's a practice, it's a science, which basically helps in diagnosis, prognosis, prevention, and treatment of diseases. And in some cases, we related this to the concept of dissection, which was an important part, wherein over the years, this has led to the creation of what is called the modern practices in medicine. And dissection is what we generally get to see as, the prelude to how we look at surgery nowadays being conducted in hospitals, or in say, for example, in medical field, where, treatment has to be done, or in some cases, treatment has to look at taking out or dissecting, or, essentially getting rid of body parts, which are going to be, which pretty much have, say, for example, conditions which are going to be causing terminal illness or spreading the disease to the other parts of the body. So in some cases, we look at even using, surgery or dissection to be able to take out those body parts which are going to be harmful in general for the human body. So when we look at this as a concept, I think the papers that I mentioned to you yesterday in particular to read were important. So I hope you have read, or at least started to read some of them. But at some stage, what you will need to do is obviously read those papers, and then draw up your own synopsis to understand the concept of dissection and how that has led to the modern day concept of surgery within medicine. Now, when we look at, some of the key bits with regards to learning outcome 2, here, some part of it is focused on understanding, the key work which has been carried out by people over the centuries. And in general, when we look at this particular work, we have to go through some of the documents, because this is making us aware of the history and the background in terms of what work has been done in the 17th century, in the 18th century, so we'll divide them into different periods. Anything which is before the 15th century medieval period. After that, we look at up to 17th century, and then we look at the modern, 18 and 19, wherein industrialization started to happen, and how these changes, within the profession, or in terms of discoveries, or in terms of, new equipments, new tools and equipments which have been used in carrying out surgery, or, essentially used for the purposes of providing medication or treatment to patients, have emerged. So there are a couple of handouts along with one or two videos which I would suggest that are required to be essentially understood. So there are two people's work in general that we would need to go through in a bit of detail, and that would be primarily looking at Louis Pasteur's work, because he's called the father of immunology, medicine, sorry, which I mentioned yesterday. And the second is Joseph Lister and his particular work. When we talk about Joseph Lister, his work, is quite critical in terms of, essentially helping us to understand germ theory. So when we look at, the work that he's carried out, he was a British surgeon and a medical scientist. And obviously his work and what he discovered is something that you need to go into to read and understand from a point of view of history. So he was one of the prominent figures within this field within the 18th and the 19th century. So he lived from, just a bit of a background, he lived from between 1827 to 1912. And he was a renowned British surgeon and a medical scientist who made significant contributions to the field of medicine. Now, he is credited with revolutionizing the surgical practices that we see today in most hospitals, or at least within the field of medicine. And his work had a profound impact on healthcare in general when it is provided from, any such outlet, whether it's a care home, care agency, NHS, a pharmacy, surgery, but essentially related to hospitals where most of the healthcare in terms of clinical healthcare is provided. Now, he was a pioneer, and this is a history that we need to go into. And there is a document that I put up, on, say, for example, Moodle, which I want to show you as I take you along in the discussions today. This particular document that we look at is basically a document which is listed here. It says evolution it says Louis Pasteur. And this particular document, when I say here, where is it? Louis Pasteur, father of immunology. So if you click open this particular document, this document will, be looking at providing you a brief synopsis of what was his work, what he did, and why his work has become, why is he then called father of immunology? And, when you look at the field of immunology in general, just for some of you who are not familiar, immunology is primarily a branch of science, which primarily deals with, understanding our immune system, body's immune system. That means, when we look at our immune system, we have different kinds of cells in our body, red blood cells, white blood cells, and platelets. And when we talk about the immune systems, for example, when you go out and if it's a cold morning, you sneeze because you're not wearing proper jumpers or not wearing warm enough clothes, your body quickly reacts and gives you a sign, or it tries to adjust to the extreme cold that you walked into without, wearing proper warm clothes. And this is your immune system kicking in. For example, you go into a particular place and you smell or you inhale something, then your body again looks at a bit of a reaction wherein you kind of sneeze or cough. And this is your body's immune system essentially kicking in, because what the body is trying to do is adapt to the new environment or the environment wherein you've stepped in. And if it is an environment which is different from what the body actually normally stays in, then what it will do is basically show a reaction, and that reaction is normally a reaction which is shown by your immune system. So when we talk about the word immunology, what the word immunology means and understands, if I look at it from a layman's perspective, it is a term which basically helps us understand our body's reaction to any sort of pathogen or any sort of untowards environment that the body is actually being subjected to. So it could be an allergic reaction, for example, during summers. When the pollen content or the pollen level is quite high in the air, sometimes some of us sneeze or have a running nose, as I mentioned, in yesterday as well. This is your body's reaction, or your body's way of adjusting to the environment. And what we then look at is the factors which are responsible for causing this reaction. And this particular aspect of studying the factors which cause that particular allergic reaction, which could be diagnosing, preventing, controlling the allergic reaction, is going to be related to what is called immunology. Now, people who work as you understand the science of immunology, would be called immunologists. That means they will be treating health issues which could be brought onto your immune system, and they would essentially be people who are specialists in understanding how does your body react, and when your body reacts, how do we control that allergic or that particular reaction in order to ensure that you remain healthy, fit, and you are well. Now, immunologists could be doctors. They are basically people who diagnose, treat, and work on various kind of systems, disorders which your body can have, and there could be several reasons. So, for example, when we look at food poisoning is a reaction to say certain amount of food or substance that you've had, and your body is not being able to adjust to it. And what causes it is that you become sick and you vomit, and then that leads to, say, your body showing a reaction, and that is called food poisoning. It needs to be immediately treated. If you look at allergic reactions which happen in your skin, say, for example, eczema, and sometimes you're asked to go and visit a dermatologist to be able to diagnose that what is causing this reaction. It could be a bacterial infection, it could be a viral, most probably a bacterial infection. Then in those cases, people who are basically treating and diagnosing these symptoms would be termed as immunologists. Now, when we look at immunology, there are obviously different branches of immunology, and people when they work and obviously work within this field, they can do specialization. So immunology could be osteoimmunology, just sharing some information with you, which could be bone related. Osteo is bones. It could be intravascular immunology, which is related to blood. So people who are experts in testing blood samples, or people who are experts in obviously things like blood transfusion and looking at blood grouping and looking at blood count or your cell count in your blood, for example, for white blood cells, platelets, which fight any such external bodies, they would be termed as intravascular immunologists. People who are specialists on skins, in the sense that they can detect how infections can, say, for example, athlete foot, which I mentioned yesterday, how fungal growth on your skin can lead to athlete foot, moist and dense surfaces, essentially lead to the growth of fungi on your skin. And those people who are experts in understanding, this kind of reaction which happens on skin would be termed as immunodermatologists or dermatology. So they are specialists on skins. And then there are other areas which you would typically look at, and these would typically be remits of what primarily the immunologists do. Now, why is Louis Pasteur, called the father of immunology? Now, when we look at immunology, obviously it originated from the germ theory. So when we look at Robert's or Louis Pasteur, Robert's work in terms of germ theory, what we do see is that he came across with the idea that human body can be infected by microorganisms, and these microorganisms are basically called pathogens, because they live on somebody else's body, which is the body of the host. And from there they derive nutrition and obviously, survive. These pathogens could be classified as virus, bacteria, as fungi. Now, when we look at, and these organisms, microorganisms, are not visible to the human eye. So sometimes we have to look at these microorganisms under the microscope. So when we look at, when we look at, say, for example, let's say the work which was done by Robert Koch and Louis Pasteur, Robert Koch essentially was pivotal in, developing and validating the germ theory in the 19th century. And Louis Pasteur's work primarily was taken further in terms of, essentially, let's say, going into details of, how the, so for example, one is the proposition of the theory, and the second was the work which was carried out by him by actually demonstrating using the process of fermentation and, sterilization and, let's say, growing the cultures in a laboratory condition to establish that there are specific organisms which are responsible for particular diseases. So when we look at the work which was carried out by, Robert Koch, the germ theory, Louis Pasteur then took it further. After the theory was established, he took it further, and he basically then looked at growing these cultures of microorganisms, and then specified that particular microorganisms lead to, different kind of diseases or illnesses within humans. So he classified them as, pathogens, and obviously these could be viruses, fungi, and, bacteria. So his work primarily that we look at in terms of establishing this through the experimentation and growing this in the laboratory to prove that this is actually what happens, and demonstrating it essentially, if I put it this way, leads to the human body getting infected by disease or, falling ill, is the work that he carried out. And this work is, obviously was very significant, and that is why he's called the father of immunology. Now, when we look at the bits that he carried out in terms of, why his work has been very specific, and why has been, why I would say he has been given this particular credit, is because when he carried out the work, some of the key areas in which he did the work essentially was, first of all, he looked at, the creation of what is called the antiseptic. Now, when we look at operations, when we look at healing the wound, when we look at, say, for example, dressing the wound and making sure that the infection does not spread, we use antiseptics. So he basically created, antiseptics, or, brought across the concept of antiseptic. And using antiseptic, at that point in time, when we look at the early 17th and 18th century, it was predominantly, wine, vinegar, or some of the other aspects which were essentially used. Some of the elements that he tried and tested with was dairy, beer, wine, vinegar, and, some of the other things. They basically led to, the creation of what is called the usage of a chemical which could be used for primarily dressing wounds or stopping the spread of infection. But he conclusively proved later in the 19th century that use of antiseptic can prevent infections, specifically in surgical procedures. And this work that he carried out, which basically reduced infection after the surgery has been carried out, was and led to the reduction in mortality rates. That means led to the reduction in death rates after patients have undergone surgery, is where his significant work was, established. So he is credited with, suggesting that antiseptic tends to be the way it should be used to basically prevent infections after surgical procedures. Now, when we look at some of the bits that, his groundbreaking work led to was the development of antiseptic practices in surgery. And this is something which has continued as a fundamental aspect of what we see in modern medicine. So the emphasis of ensuring cleanliness, hygiene in health and social care settings, and the use of antiseptics to primarily, help in the post-operative surgery environment so that infection risk is minimized is the work that, he has been credited with. Now, as I mentioned, he was a British surgeon and he was also a medical scientist. Some of the experimentations that he carried out and the framework and, some of the things that he proposed led him to gain prominence, during this time. And obviously, this allowed, medicine to develop, wherein the mortality rate, which is the death rate of people undergoing surgery, started to go down. So if we were able to control infections from bacteria, viruses after the surgical, procedure was done, then the reduced infection rate also led to, decrease in the death rate in patients when they had undergone surgery. Now, the use of things like his contributions and obviously his work, which is highlighted in this particular article, talks about, the antiseptic techniques that he proposed in terms of how, that they can be used. So he proposed carbonic acid, which is basically what we call phenol, as a disinfectant to be used during surgeries, which basically reduce the risk of infection, specifically in the case of post-operative, procedures. He also emphasized the aspect of hand washing, which basically meant that all surgical instruments before they are used in the surgery or for the procedure need to be sterilized. People who are actually participating in the surgery need to be, also sanitizing and making sure that the medical staff is washing their hands and instruments with carbonic acid before the procedure actually starts. Then he also came across with the concept of sterilization. Now, he advocated that sterilization of surgical instruments and dressings further reduce the harmful impact of bacteria during surgery. So things like sterilization of all the instruments that are normally used within the operation theater was strongly propagated by him, and this also leads to the reduction in terms of bacterial infections which can happen when the person is undergoing surgery. Now, some of the results that some of the techniques, let's put it this way, that he suggested were very basic. Things like use of antiseptic, sterilization, hand washing, essentially using and making sure that the surgical instruments are properly sterilized along with the staff which are participating in conducting the surgery led to results which over a point in time proved that it led to decrease in the death rate in patients after they have had the surgical procedure or the operation done. And this bit of work, which was done by him, revolutionized what is called the surgical practices and laid the foundation of what is called the modern antiseptic techniques that we use today in most hospitals and operation theaters. Now, that is why he has been, given the title of Father of Immunology, because his work demonstrated beyond doubt that why these, bits or things that we need to do are important in terms of, let's put it this way, patient undergoing surgery within hospitals. So the work that Robert Koch, essentially carried out, and the work which essentially then was furthered by Louis Pasteur, and then later on, developed into the process of looking at how antiseptics and, for example, the field of, say, in this case, immunology, which is basically understanding the body's immune system and making it secure from outside to ensure no bacterial infections can actually affect the body, and it can help the biological processes to function in a way wherein it helps recover in the recovery of the patient after they've had the surgical procedure, was the work which he carried out. And that is where he's credited with these important developments which have led to the, let's say, the concept of what we get to see as modern. I'll put it this way, that this has led to the development of what are called the modern antiseptic practices in surgery, and these are then related to healthcare, hygiene, and also ensuring that practices related to the antiseptic practices which are related to ensuring, say, for example, the hand washing, carbonization, and sterilization of surgical instruments in the theater, thereby reducing the rate of infection, which can which can essentially, lead to the patient recovering quicker, and prevention of this leading to any sort of complications after the patient have undergone any sort of a procedure. So this particular handout that is there is something that you can basically look at, going through, and it helps you understand the details of, the functions or the details of why immunology became an important subject, and how Joseph, in this case, how Louis Pasteur's work, essentially helped in the development of what is called the antisepsis system, looking at the use of antiseptics within modern surgery. And that is why sometimes, he's called the father of immunology, or father of modern surgery, because his work actually laid down the foundations of what we get to use and see when surgeries are carried out in hospitals. Because if these steps are put into action, it basically helps in reducing the death rate from infection, not death rate in general, but death rate from infection, primarily after the surgery has been, or the surgery in terms of treatment has been carried out. And that is why he's best known for his work, which is the application of germ theory to surgery, and leading to the creation of what is called the science of immunology, and use of antiseptics and sterilization in the process of carrying out what is called modern operative surgery that we see today in hospitals. So that is what we need to understand as far as Louis Pasteur is concerned. Now, when we talk about the second aspect of, if I go back here, looking at the work which has been carried out by Joseph Lister, and obviously we look at the history of medicine. There is a particular video which I want you to, which I think I asked you to go through yesterday, which is the role of various individuals in terms of what their contributions have been, in particular, with regards to leading to, say, for example, new discoveries and inventions in the field of medicine. This particular video, if you had watched, or if you haven't watched, is a video that we need to look at in particular. And this particular video would throw a lot of light in terms of what is the what are the various contributions which have led to the development of this modern field of medicine. And this, in some cases, can also be studied, primarily through some articles which have been published, predominantly in journals, in medical journals. And these articles that I look at, look at basically, let's say, dividing this particular, or basically looking at periods in which, major developments have happened over the years within this field. So if I share this particular screen, with you, in this screen, what I've done is, there is an article which is published on the National Library of Medicine, and this article talks about the history of infectious diseases and medicine. Now, this table, is of importance here, because when we look at the history of medicine and we want to look at summarizing the key individual contributions which have been made by people, and which is what we get to see in modern medicine today, we want to be able to look at segmenting them across various centuries or periods that we would normally see. So when we look at the Western classic medicine, which is ancient to the 15th century, we look at, different. So, sorry. So we look at different diseases which basically plagued, and were various pandemics which basically, which have happened in, the human history. We look at the plague of Athens, which was in BC 429. Then we look at the Antonine plague, the plague of Justinian, and the Black Death, which was primarily in the 12th and the 13th century. Now, here, the diagnosis and treatment primarily at that point in time was done, using what is called uroscopy, pulse reading, and hygiene therapy. When we look at traditional medicine, that period is between the 16th to the 18th century. So there are 5, as you can see, periods which we need to look at broadly just to bring our knowledge up to date with regards to how medicine and the field of medicine has actually, progressed. So we have ancient to 15th century, we have 16th to 18th century, we have early modern medicine of 19th century, late modern medicine of 19th century to 1980s, which is the early 20th century, and then anything which is basically beyond 1990. Now, this table highlights the basic parts in terms of how and why major events which have happened in the human history have led to research and, obviously work being carried out by different scientists or, I would say medics over the years, and why we want to look at Joseph Lister's and Louis Pasteur's work, because that lays more or less the foundation to what we get to see today being practiced in modern medicine. So Joseph Lister's work in terms of surgery, immunology, and then why we need to look at taking precautions and then reducing the death rate after surgery. And Louis Pasteur's work, because he was a microbiologist and he basically, came up with germ theory, and, his work was fundamental to understanding that how humans get get infected by microorganisms, and then that leads to diseases, illnesses, and death if it is not treated, and how infections let's say it gets transmitted from one person to the other. So when we look at this particular article, this gives you a bit of a background into studying what we see from a point of view of history of medicine. Briefly, because this article summarizes the key developments which have happened in various centuries and in terms of what people have worked primarily on and how this has led to the development of modern medicine. So this is what you need to look at. Now, there is one other article which I would suggest that if you are really interested in going into details and understanding what leads to what developments over the centuries has led to the development of medicine, and whether it was present, practiced, in the earlier days as well, is something that you can also go through when we look at this particular article, which is on Wikipedia. Now, it is a fairly large article, and obviously it provides, information about, it provides information primarily about, the aspect of how medicine as a field has evolved. So it is a good read. I would suggest that for those of you who want to get into the details and obviously want to understand in terms of the key developments and eras or periods during which this development has happened, and how and what we get to see today as hospitals or basic procedures which are carried out, we see the beginnings or origins of this happening in all civilizations, even when we go back and look at centuries and centuries of data. And this is a good idea, I would say a good read, and I would suggest a good idea, because if you want to look at this as a whole, actually gives you a very good understanding in terms of the key people who have made contributions towards what we study in, say, for example, they say ancient prehistoric medicine, ancient medicine, post-classical medicine, early age, late, and what we generally get to see today, which is contemporary medicine. So, and various people who have done contributions to to this particular field are all listed here in a very good, I would say, balanced summary. So you're not reading too much and you're not going into too much detail, but what these discoveries, procedures, let's say work which has been carried out and how they are related to certain fields like medicine, nursing. You look at, when pandemics happen or when major outbreaks happen, like of cholera, plague, bubonic plague that we've seen in the 17th and 18th century. Now, in the modern age, we've seen the COVID-19 as a pandemic, and how this has led to the rise of some of the other professions which are related to medicine and very closely related to medicine, like nursing, statistical methods, psychiatry in general. Would also be then covered in this particular article. And this would essentially allow you to understand, and if you go through this, it'll help you understand and summarize in a way what are the key contributions which have been done by various individuals in the field of medicine, and how their contributions have led to the creation of what we call contemporary medicine or modern medicine. And in general, with regards to the content of the unit, what we need to be able to do is understand Joseph Lister's work, which is primarily related to the concept of immunology and modern surgery, and Louis Pasteur's work, which is related to germ theory, thereby allowing us to understand how infections, how microorganisms can be harmful to human body and how they can cause infections, how transmission of infections happens. And then the work that he had done during the creation of, or the proposition of, germ theory led to further work by Joseph Lister in the field of vaccination, immunology, and that is where we now understand how things like sterilization, use of antiseptics, use of clean, use of hygiene essentially, to ensure that the healthcare, practices that we do, or the facilities in which surgery tends to happen, need to be clean and safe, which allow the reduction of, which lead to basically the reduction in any sort of complications or death after the surgery has been carried out. So this bit is more of reading, specifically related to, I would say, understanding the learning outcome too, but from a point of view of looking at, understanding the work which has been carried out in terms of changes that we get to see over the centuries, which has brought us across to the concept of what is called modern medicine. Is that okay? Any questions on this so far? Any questions at your end? Anything that you have not understood?
No.
So go on, sorry. Yes, go on. Any questions? Go on. So in general, if there are, if you want to understand broadly the learning outcome too, which I understand the changes in medicine that have brought about, over the years and over the centuries, these are the handouts that we need to go through on Moodle, because it is important for us to understand the history of where medicine has come from, who has contributed to the work in terms of this field becoming important, and these are the bits that we have to go through primarily to understand this. So this bit is primarily the Wikipedia article. There is a video which is primarily given here, and then these are handouts which are predominantly on Moodle that I would suggest that you need to go through to be able to summarize and understand the key work carried out by individuals who have led, who have contributed significantly. And that is what we know of how modern medicine has currently, evolved over the centuries. So these key individuals are Joseph Lister and Louis Pasteur, and their significant contributions have laid the foundation of what we get to see as contemporary medicine or modern medicine in today's context. Now, the second, assessment criteria is basically talking about looking into details of how inventions of key medical implements and machines have advanced medicine today. So here, what we want to understand is that over the years and centuries and decades, if I put it this way, years, decades, and centuries, there is a lot of in a lot of inventions which have happened, and these inventions in the field of medical instruments have then led to the development of diagnosis, better diagnosis, for example, and better treatments. Now, what are these major instruments which have come about over the years, decades, and centuries? So there are some articles that I put up here, but I will take you through and I'll show them to you on Moodle as well, because this is important again to understand that, say, for example, when we talk about, let's say, if I talk about, say, a different field, like in terms of electricity, or if I talk about telephone, for example, now how was telephone invented? How did the telephone cabling start? And today what we see is we had what you call the telephone lines, wherein you had a different, let's say, when it was introduced by Graham Bell in the 1890s, discovered and the concept, started, you had a different mouthpiece and a hearing piece. You could only say one thing, and, it was one-way communication. So if you were talking, the other was listening, and if they were talking, you were listening. But slowly and gradually over the years, the technology has improved. What has happened is it's allowed two-way communication. And then in the 1990s, we saw wireless spectrums being opened up, and we see mobile phones coming across. And today mobile phones allow you to do, multiple tasks. So this is to go into history of understanding how telephone and the invention of telephone actually, happened. And then advancements in technology as we understand more and more, and contributions by various players or people essentially led to what we get to use today as, a modern day smartphone. So even if we go back to the early 2000s, we had most of the phones which were keypad-based phones used only for texting and voice messaging. But today, smartphones allow you to do multiple functions, shoot a video, send an email, talk on the phone, do a text message. All of them can happen simultaneously. Similarly, in the field of medicine, what we need to do is understand what are the key inventions which have happened. And these key inventions which have happened over the years, decades, and centuries have led to the discovery of new instruments which are today used in modern medicine. So this particular task talks about what are the key inventions that we get to see and how these inventions are useful for individuals, practitioners within this field, medicine field, doctors, nurses, physiotherapists, occupational therapists, healthcare workers, to be able to then better diagnose and provide treatment to patients. So if I look at this particular aspect and we go into, some of the articles which are essentially, that I've shortlisted and put up on Moodle, are the ones that will give you, an insight into how these inventions have happened, when have they happened, and how they have contributed to providing, let's say, development of advanced techniques that can be used by medics, practitioners to essentially, provide, let's say, diagnosis and then treatment using those instruments. So let me switch you over again to Moodle. And this is this particular article that I'm referring to that you need to look at, which is medical devices, managing the mismatch. Now, this particular report by the World Health Organization, if I just sign back in and then show you exactly where this particular report is. So if I go into this and then go into unit, which is what we are discussing. So this is this particular report, which is medical devices, managing the mismatch. When you open this report up, what we are going to see is this is a 150-page report, but it basically helps us understand what are medical devices, how they've been invented, and what are the key inventions of these medical devices, and how they are used today in advanced medicine to help in diagnosis, treating, and prevention of diseases within humans. So this particular book, if I put it this way, because it's about 150 pages, but if I take out all the pages which are not required to be read, like the overview towards the end, you are looking at reading about 90 pages in total in this book, because some of them also have pictures, they are table of content and other indexes and other bits. But about 90 pages is what you need to go through briefly to understand the invention of key medical instruments, how these medical instruments have been invented over a period of time, why they have become significantly important, and how they are used today in modern medicine to treat patients, by medics. So when we look at this particular book, there is a timeline, because the reason why you need to read this particular book would be that there is a particular task in your assignment in this unit, which will ask you to list out the key medical instruments which have been invented over the years, and you would need to draw up a table. And if you know, I think in this book, there are over 150 different types of medical instruments which are covered. So when we talk about the X-ray machine, the MRI scanner, the blood glucose testing machine, the stethoscope, for example, the blood pressure monitor, the surgical instruments, these are all inventions which have happened, which allow us now to use these instruments in providing, treatment to patients in one way or the other. So what you would need to do is basically, from reading this particular book, draw up a table at some stage, which will obviously come in the assignment. And that is why this is important for you to go through and understand the history of how medical instruments were discovered and introduced, and how and when, in what era they have been introduced, which have now allowed, these medical instruments to be used for providing treatment, to patients. And sometimes it is also termed as what is called machines, which are helping in advanced medicine or providing treatment to patients using, equipment. So things like an MRI scanner, I don't know in terms of when was MRI scanner, invented. So when we talk about when was MRI scanner invented, this is something that we need to know, and who invented it. And what does it help us do is something that you might want to be interested in. And this is something you might bring into your assignment, because at some stage you will create a table and talk about 10 medical instruments which have revolutionized modern medicine. So if I look at MRI scanner, the one that I look at, for example, and in terms of one of the instruments, it was basically discovered by, Paul Louis Burr, who was a French, let's say medic, and Raymond Demanian, they worked on this, and they created what is called a technology which basically uses X-rays and infrared sensing to create, a layout of the body. Now, that layout of the body, when it is published, or basically produced as a report, allows, the patient's, say, for example, body structure to be created using what is called magnetic resonancing field. And this, which was the, technology which they developed later on, led to the creation of what is called an MRI scanner. Now, MRI scanner is basically a body scanner, which you lie down and go in, and obviously it scans your body and then creates a structure of your body. And this is something which was used in the 1970s. The initial products were created based on this technology by GE Healthcare, and the invention of magnetic resonance imaging, which is what MRI stands for, is one of the important developments in the history of usage of medical instruments. And this bit allows magnetic resonance imaging to create body maps, and then allows the detection of any sort of anomalies in the human body. And this can be used then by doctors, medics, to look at appropriately treating that particular illness or that disease. So there are lots and lots of different types of instruments that you will see, which have been, listed down in this particular book. And if I go down to the bottom or the end of this book, there is a table which you would see listing down. If I just quickly scroll down for a second. Towards the end, I think there is a table which kind of summarizes, the key medical instruments and the key medical instrument discoveries which have happened, which allow essentially, basically a bit of a summary, which allows you to understand that when these were introduced, and how they have become a part and parcel of modern medicine. So if I look at, say, for example, a particular, table in general, when we look at, say, for example, some of the instruments that I've seen, I've used over the years, and we've got them in the, center. We've got a stethoscope, for example. Now, this was an invention which basically, let's say, revolutionized medical examinations, because this allows doctors to listen to sounds in your body, which could be either breathing or your heartbeat. And in some cases, this is sometimes also used when your blood pressure is being taken, the diastolic and systolic blood pressure is being measured. So this is a particular invention which happened in the 18th century, to be precise, 1815, and this is also listed somewhere in the book as a table. And if I go into the key bits, this is the table that I'm referring to, and if I go into the key bits in terms of when and how they've been discovered and how they are used, this is what you need to go through to understand this particular task, in terms of explain the details of how inventions of key medical implements or instruments have led to the development of modern medicine. Now, after this, if I'll go into, say, something like anesthesia, the use of chloroform, or a chemical which allows surgeries to be performed when primarily patients can be put to sleep, and this allows surgical procedures to be done in a much more less painful way, and this also allows the enablement of complex surgeries to be performed safely. So when we talk about essentially the development of anesthetics and the instruments around anesthesia, which are used to let's say which are used essentially to provide this and use it in this field, is another development which basically is related to the implementation of medical instruments. Then we look at things like endotracheal tubes and catheters. Now, this particular is important when, for example, the use of disposable catheter. When we talk about this, so this is an important part, because when we look at dispensing certain types of medication to patient in surgeries. For example, when we look at a catheter, I don't know how many of you know, but I can show an image in a second. But this is a tube primarily, which allows, say, for example, when we look at people which have kidney malfunction, or in some cases when we have to drain out excessive fluid from the body, then these are bits which are used to drain excessive fluids from within the body. Then the common reasons why catheters are used is because in some cases this is related to the urinary system within the human body, and this catheter is a flexible tube which basically helps in emptying liquids or bladders when the human body is not able to drain the fluids or the liquids after surgery. So generally you would see saline solutions or other bits which are being put into and provided to the patient for nutrition and for feed. At some stage, catheters are put primarily in the urinary system to drain excessive liquids out, and this is obviously a major development which allowed more complex surgeries to be essentially carried out, and again is one of the things that you would look at primarily for the purposes of understanding the discovery of instruments or machines which has allowed complex surgeries to take place. Things like an X-ray machine. So I don't know, we might not go into some of the very details or specifics, but things that you generally think of when you think of a hospital, they come to your mind. Visually, you could be looking at some of those and thinking about it, and then from the book at least look at getting hold of those, getting hold of the information about that machine by putting in a picture would again be useful for you when we look at the aspect of covering this particular task. So things like X-ray machines, MRI machines, for example, blood glucose testing machine. You look at heart lung machine when people undergo surgery. specifically bypass surgery, heart-lung machines are, used in such complex operations or operative procedures. And these are very important, significant developments which have happened in the field of, let's say, machines, which allow medicine, or in this case, operative procedures to happen as far as essentially operations are concerned within hospitals. So when we talk about the history and advancements of how these medical equipment has led to better diagnosis, better treatment, and better, let's say, administrating support after the after the surgery has happened, are instruments that you would need to talk about, or medical instruments that you would need to talk about, in the field of in the field of medicine. And this would be something that you would need to relate to, in terms of task 2.2. So if I switch you over now, just back to the slide, and we look at, so these three different, one is the article which I showed, which was the table that you need to look at, understanding how we can divide some of these things which have happened. So when we look at Marie Curie's work in terms of, nuclear medicine, for example, chemotherapy, which is done primarily to treat cancer, that is the work which is very recent, and, obviously that is related to nuclear medicine. Some of the medical inventions in the 1800th century, which has led to the, starting of the equipment or medical equipment, which has been used now within, the field of medicine, is another article which has been put here. And then when we look at modern day, discoveries, the use of artificial intelligence primarily in health and social care, and this is providing remote medicine. For example, doctors-based robotics, for example, is one such area wherein doctors based in one location can actually do remotely a surgery being carried out miles and miles across, or thousands of miles across, using internet. And modern usage of technology and robotics is another example of how medical equipment and implements are being used today in modern medicine. So depending on how much interest you take, I would suggest that you read this ebook, which provides a detailed information into the modern equipments which are now used in medicine, and how they are helpful in treating patients. And I would suggest that you at least form a list of 10 to 15 such modern equipment which will be useful for you at a later stage to do your assignment, because one of the assessment criteria would be talking about listing down or creating a table which would essentially require you to list down 15 medical instruments which you think have become important today in the field of medicine. Is that okay? Any questions on this so far?
No.
Okay. The last assessment criteria is related to 2.1 and 2.2. Here we need to do a bit of analysis. So what we want to do is we need to pick up one particular area of work that you would want to focus on. And what you would need to do is go into a bit of more detailing. So when we talk about the advances in the field of health and medicine in particular, what we need to look at is what are the various advances and what are the timeframes in which these advances have happened in terms of health and medicine. So when we talk about these advances, you would need to create a bit of a timeline. And this particular timeline, when we look at, is going to be related to some of the key developments which have happened, over the centuries. And that is what you need to list down to do your analysis. Now, there is a particular article that I've, put on the Moodle, and this particular article talks about, how services, let's say, from a modern day concept. What I want to look at is basically looking at a particular article which is talking about how some of the practices have now got implemented within the NHS. So let's look at broadly the National Health Service and how this is in incorporation of these practices, whether it's modern medical equipment or the work which has been carried out over the years has led to the development of modern practices which are now practiced and essentially prevalent in the National Health Service. Now, this is something that you can go through, and obviously at some stage you would need to summarize this in terms of your own words. And this particular article that I put in, basically talks about how the major developments which have happened, over the years, decades, centuries, have led to the development of the concept of what we call doctor knows best. Now, this particular concept that we talk about, doctor knows best, is a concept that is not something which has emerged years and years back. When we look at patients knows best, and when this particular concept of person-centered approach was included, and more work was done in the 20th century in terms of understanding ethical practices within medicine, and physicians or medics were asked to look at following these ethical practices. This is where the concept of doctor knows best actually originated. Now, this particular concept, which basically balances that what the patient knows and what the doctor knows, and how we reach a balance between the two to be able to then ethically do practices for providing, practicing medicine and providing, treatment, is something which we need to be, essentially talking about in the analysis here. But when we provide this, what we are going to do is basically look at, relating it to some of the top medical equipment or instruments which have also been discovered over the years. So this particular task talks about you creating a bridge between what we have learned in terms of the work and the key work which has been carried out by different people over the centuries. So we look at, say, Joseph Lister, Pasteur, Robert Koch, some of the others. And then in the second part, medical instruments which have been discovered, and they have also now become a part and parcel of the let's say the modern medicine. So you have to use both of them to be able to establish that how this has led to the creation of a domain or a concept which talks about doctor knows best. Now, here, what you have to look at is, when we look at this particular, concept of doctor knows best as a phrase, this is a traditional view used in medical practice, which implies that, medical practitioners are considered epistemic authorities. That means they are essentially people who have academic knowledge and experience of the field of medicine, and whatever decisions they will make will be based on ethical practices which have been established over the years. So when we talk about the General British Medical Association, the BMA, they have created certain principles and laid down certain policies and procedures, and these are followed essentially when medical practitioners are providing or making decisions to provide services to patient. So this particular field wherein we look at a transition, let's put it this way, between contemporary healthcare practices, which are shifting away from the model of patient knows best to the model where doctors and patients are both involved in making the decision, is the concept of what is called doctor knows best. So previously, most treatments were done on the basis of what patients came across and mentioned and said, and then the treatments were done. But nowadays, the concept has moved wherein both the doctor and patient are involved in the decision-making process, and both of them using their knowledge, their experience, and obviously doctors or medics in particular, being authorities in this area, are then asked to make ethical decisions which can lead to better outcomes for the patient, and obviously leading to the patient or patient recovery or patient satisfaction. So this shared decision making, which allows patients to actively participate in the choices which are being made for their healthcare, for their treatment, or for any sort of diagnosis, would be looking into considering their values, their preferences, which is the person-centered approach, alongside the medical expertise which the doctors bring. And that is why doctor knows best, or DKB as a concept has come into being. So this approach, which basically looks at taking into account medical expertise, which is from the medics and people who are in this field, alongside taking the preferences of users, needs and preferences of users, which is patients, while creating a care plan or providing care or treatment or diagnosis to any such condition which the patients are coming over to, rectify or basically seek attention, is the concept which allows this balanced approach to go forward. And this approach is basically a collaborative approach because it helps in the creation of a relationship between a healthcare provider and the patients, and it leads to more personalized and effective care plans. This has now led to the creation of what is called the ICC, or the Integrated Care Plan. Because if I give you an example here of why this has become important, imagine a person is undergoing a surgery. For example, they are admitted in a hospital and they are undergoing, say, for example, a heart, bypass surgery for their heart because of the blocked artery. Now, there are different teams which are going to be involved in, undergoing when the patient undergoes this surgery. So let's start and put a creative hat on. Let's think, how does this process start? So as a patient, sometime, somewhere in the last couple of months, the patient would have started complaining of, or the person in this case, it's not a patient right now, the person would have started complaining of chest pain. This chest pain could have been erratic, could have been unusual or irregular. And at some stage, the person would have decided that I need to seek help because this is not one-off thing, this is happening again and again, but at certain intervals. At some stage, the person then goes to the surgery, takes an appointment with the doctor, GP, and the GP then looks at certain tests, would suggest a few tests like blood test and, look at referring to a consultant. Now, once the patient, or in this case, the person has been referred to a consultant, they would carry out further tests. A stress test would be carried out when you are asked to go on a treadmill. You might be looking at, doing tests which would primarily be like the ECG or electrocardiogram. Your ECG is taken, and what the hospital or the medics in the hospital would then try and do is come to some sort of a conclusion that is it something which is leading to angina, and is angina going to be fatal, is going to lead to a heart attack. Now, at this stage, the person becomes a patient because it has been diagnosed that the person is having persistent angina, and a number of tests which have been carried out, like a ECG test, blood test, and for example, a stress test, at some stage confirm that the person has some sort of a blockage in the heart. Now, in order to confirm this, the patient would be offered a consultation with the doctors who are going to determine beyond the fact that the patient would need surgery. Now, that consultation would happen with a medical registered nurse. There would be some staff involved who would be maybe looking at, getting involved when the surgery actually does happen. There might be a doctor and a consultant surgeon who would be actually looking at doing this. Now, the family members and the patient itself are then called for a consultation. They're given some documentation, and the patient undergoes that consultation to see what are the options available with him to be able to undertake this particular, process or procedure. Now, complications of the procedure are discussed. Steps in terms of how the procedure is going to be carried out is discussed. What are the adjustments the patient needs to make before the procedure is carried out is discussed. And at some stage, when all this is done, the patient would be put onto a waiting list and would be asked to follow, and some medication would be prescribed, and you would go into that process for a couple of weeks before your actual surgery happens. The patient might decide, don't want to have a surgery, and the doctors might have to go back to the drawing board to say, okay, how do we tackle this situation through medication? Now, this process that I'm talking you through is basically looking at a consultative approach between different parties, starting from the person to the GP surgery, to the hospital, to the consultant, to the medical team, which will be working and looking at if the procedure is to go forward, highlights that the needs, wants, and preferences of the patient are taken into account. The family members are briefed, enough literature or information is provided even before the surgery, or the patient is put onto the waiting list. Number of tests are carried out, and they are going to be carried out in conjunction with the patient's wishes and preferences to establish whether this can lead to a heart attack or this can lead to a heart condition which could be fatal for the patient. Now, this approach is called the doctor's knows best approach because it involves both the patient and the doctors jointly working towards coming to a decision whether the patient would need surgery or whether the patient would be treated with medication. Is that okay? Is that understood?
Yeah.
Can you give example of the patient know best as well?
Okay. So when we look at this concept of patient knows best, I don't know whether you read the article which was there on Moodle yesterday, which I've mentioned that you need to go through that article. Did you go through that article?
I read, but the understanding was not really.
Okay, so let's look at what is the approach. Let me explain.
Break it down a bit
sure.
how you did now.
That's fine. So when we look at this concept of patient knows best, this is a phrase which basically originated out of what is called PCC, patient-centered care. And sometimes when we look at studying one unit, which you'll obviously study in nursing, which is called person-centered approach. Now, person-centered care as an approach or as a concept has been adopted into the healthcare sector in the early 2000s. This was a concept which primarily was initially, there was work done by Carl Rogers, which was an American psychologist in the 1960s. Later on, as I mentioned, yesterday, that it was adopted by the American Medical Association. So gradually, it was introduced in the NHS in the 1997, in the early 2000s, and then became a part and parcel of the NHS services in 2008 after the Lord Darzai's report recommended that this is a good approach wherein we need to take into account the needs and preferences of the patient who's undergoing or is going to undergo or get treatment from the National Health Service. Now, this particular concept is based on a sociological model of healthcare. And this was initially proposed by George Engel, and the work initially done by Carl Rogers. Later on, it was, put into a bit of a structure around what is called the patient-centered approach. And this particular model, was then accepted, and it was proposed by George Engel, and later on it was accepted by the wider fraternity. Now, this particular model, which put emphasis on the importance of what we need to do is not only recognize the biological aspects of patient's condition, but also look at psychological and social factors when we look at providing care. That means if you look at if a person, sticking to the current example of which I've explained, that a person undergoing, heart surgery, if you look at going back a bit, at some stage when these consultations happen with the doctors, the patient, there are family members of the patient which are also involved, because assuming you go through with the operation, you have the surgery, it is successful, but after the surgery, the patient would need, support from the family and the wider healthcare community, which is social workers or healthcare workers who would visit the patient, physiotherapists, for example, or other people, other form of practitioners, which will essentially be involved in providing post-operative care. And this care would be provided by a team, of professionals. So when we look at this particular concept wherein needs and preferences of patient is taken into account, but in order for the patient to recover and, undergo a particular surgery and then recover, or maybe if a patient has had an accident and needs to recover from that, you would have lots of other different medics which will be, or practitioners which will be involved in helping the patient recover from that incident or from that accident. And here the patient would need support in terms of ensuring that although the care being provided is patient-centered, that means the needs and preferences are taken into account, but they would also need the support of larger fraternity, which would include health and social care workers, nurses, it will include family members, and it will also in some cases include, therapists, which should be looking at the psychological condition of the patient as well. And when we take into account these three aspects, when care is being provided to the patient, that means we take into account the patient's condition, we take into account the psychological factors and the social factors, and then create a care plan, then this particular approach is called patient knows best, because you're looking at everything around the patient in terms of needs, preferences, family members, and the support that the patient needs. And this approach was essentially the patient-centered approach. Now, in practice, this approach involved healthcare professionals and the dependence on the healthcare professionals, not just to be able to diagnose and treat the problem, but also taking into account patients' mental and emotional well-being by supporting the patient through the social support system. And that is what the patient-centered approach is. So if the patient undergoes surgery, after the surgery, it is not just going to be the doctors, nurses, and social care workers which are going to be helping in the recovery of the patient, but it will also be the family and other psychological factors, social factors, which will be required for the patient to be able to get back on its feet. And this is an example wherein I would say, okay, I've had the heart surgery, I've had an open heart surgery, for example, an open bypass, open surgery, heart surgery, or a bypass surgery. My chest has been opened up, stitches are there. It takes at least 12 to 16 weeks for you to fully recover, for you to start walking and running or going back to your day-to-day activities. And in those cases, the patient obviously knows the condition and is able to talk about it. But at the same time, the patient also needs support primarily of the wider social structure, which is family and healthcare professionals, to be able to get back onto their feet. So in that case, the concept was primarily based on patient knows best, because we are only listening to the patient, but we are not depending on the medical expertise or the advice which the medics would be able to provide in how the patient would be able to get better and get back onto their feet soon. So rather than have one lopsided approach of only patient and going by patient's needs and wants and preferences, this concept was later, adopted into the NHS and the practices in the NHS to say the doctor knows best, wherein the approach of the patient's needs and wants and requirements, along with the expert medical advice, which comes from the medical practice and experience of the medical practitioners, are taken into account for decision making, is the concept which is now changed from PKB to DKB. Patient knows best to doctor knows best. Is that okay?
Yeah, that's fine. Thank you very much for the explanation.
No worries. So when we look at this particular learning outcome and criteria, what we have to do is take an example of how the advances or the work which has been carried out by different individuals in the field of medicine is then linked to the advances in medical equipment. And that is where you would do the analysis by taking up an example. So you might not want to look at work of all the key professionals like Robert Koch, Joseph Pasteur, Louis Pasteur. No, you would only pick up one, and the list from the list of instruments or medical equipment which have been discovered, you would probably pick one or two, and then using an example, explain how this is relevant and useful for treating patients in today's context. And that would be the criteria of your task 2.3. Is that okay? Now for 2.3, there is a specific article which I put in on, from the King's Fund, and I will explain and show this to you in a second, because this particular article, if you go through, would essentially help you understand, this particular assessment criteria, which is criteria 2.3. So let me just open that up. And for those of you who want to look at, this particular concept of person-centered care, I think I'd shown a bit of an article yesterday from the Health Foundation, And that particular article, essentially from the Health Foundation, I have also uploaded on Moodle. Let me show you the screen. And these two articles, if you look at, would allow you to, let's say, understand this particular assessment criteria in a bit more detail. So let me show you on Moodle. And these are 3 or 4 things that I would suggest that you have to look at going through in order to understand this approach of doctor knows best. So let me just switch you over. Okay, so that bit is now up on your screen. So if I look at this particular article, which is Doctor Knows Best, and this particular article, which is Person-Centered Approach, for those of you who want to read and understand why this has become an important concept and why we look at the balanced approach, you would get this from here. This is the article which I'm referring to yesterday, which is related to Patient Knows Best and Person-Centered Care. So a good article for you to read. This would allow you to understand why the concept has moved from PKB to DKB, which is Doctor Knows Best. Now, with regards to the task 2.3, continuity of care and patient experience, and how the concept has merged from patient knows best to doctor knows best, is basically explained in this particular handout, or I would say a report. So here we look at chapter 4, which is where we talk about patient's perspective, and then how this has changed to having a collaborative approach of patient and medics or medical practitioners who are expert within their field because of their experience in academic side of things, are then bringing that information together collaboratively to make decisions which are going to be in the benefit of the patient. So that is something. Chapter 4 is something which I would suggest that you need to read, which would give you more information on say, for example, the example of sometimes, for example, I'll give you one example here just to make a point. When we look at the assessment criteria 2.3, assume that a mother is going through, the process of delivery. That means at some stage you're now admitted to the hospital, you're not having a normal delivery, you're say, for example, the time or the period which has been given for a normal delivery, the date has elapsed. Now, what will happen is that at some stage, if you were given that, okay, if you were expecting, you'll probably look at between 7th to 10th of November as a delivery date. But if it has not happened and it's gone past 10th of November, then a couple of things will happen. One, the team of nurse or midwives which are working with you would obviously then inform the consultant or the doctor and say, okay, now we need to induce, delivery, because they would ask you to do an X-ray, or maybe a scan would be done to see whether the cesarean section is required, or the C-section as we call it. Now, in this case, the expertise of what condition the patient is in and the expertise and the experience of the consultant would be taken into account to ensure both mother and the child are safe. So the collaborative working of that tends to typically happen. So they will primarily induce childbirth. They can look at forceps delivery. Sometimes, delivery has to be induced, and, if forceps delivery can be done, you are given certain medication to ensure that, the natural delivery can happen. But if it doesn't happen by trying out some of these procedures, then at some stage, the consultant would have to put a foot down and say, no, we will have to go in for C-section. And that is where the medical advice or the experience of the consultant, the doctors, come in to ensure that both the baby and the mother are safe. And that is where the C-section is then advised, because the time has elapsed. All the other procedures in terms of, ensuring that natural delivery can happen or normal birth can happen have gone past. And here the doctor knows best in terms of what is good for the mother and what is good for the child, because he and the team of people which are working which is the nurses, the midwives, which are working to ensure that the delivery is safe and the mother and the baby are safe, would then work with the patient to explain that that's the only option. The patient will consent, and then the procedure would happen. Is that okay? Does that example explain, where we look at the approach of patient knowing best and also the doctor knowing best at some stage to then make a decision jointly, and then look at the C-section to make sure that both the baby and the mother are safe. Is that okay?
Yeah.
Now, this bit, so this particular bit helps us, and these are the various articles that I would suggest that at some stage, you would need to read. So if I look at just expanding this and then, making this slightly bigger. So this is a presentation here that I've taken you through today. And these are some of the articles which I would suggest that you need to go through to build up and, bring up your knowledge in terms of the history on the inventions of medical instruments and the key people who have been credited with the work that they've carried out, leading to the field or development of what is called modern medicine. So the presentation are basically, it's a set of slides just acting as, signposts to be able to go through and then read what you're required to read in what parts to be able to catch up on this particular, assessment criteria. So this also towards the end brings us to the end of, discussion on this particular unit. And what we are going to be doing next week is primarily then looking at going through what is called the assignment brief of this unit. And that would mean before I do that discussion, it's a good thing that this session is next weekend on Saturday, because this will give you enough time to be able to go and read through some of the stuff that I've taken you through. And you have read all this, the important bits of articles that I pointed out, and that would allow us to have a fuller discussion on the tasks and how you would put together the evidence to compile the assignment and then achieve this unit. And let's not forget, if you recall, which I mentioned earlier, that this is a graded unit. It's a theoretical unit. All of you should be looking at achieving a distinction grade on this, because this is an important unit within the course. So being theoretical would mean that if you're able to creatively bring across and put some of the things in the assignment, you would be able to achieve, a higher grade or highest grade, which is distinction, which is going to be useful, specifically considering, this being one of the core units in nursing. Is that okay?
Yeah.
Good stuff. So this brings us to the end of today's session. I'm going to, just basically ask once more if there are any questions or anything that we've discussed today not been understood, then do let me know. Otherwise, I'm going to try and make available a copy of this particular session in a couple of minutes on Moodle as well as on WhatsApp group, and then I'll catch up with you next week for discussing the assignment.
Yeah, I'm okay. Yeah.
Good stuff. So thank you so much for attending today, and I'll catch up with you next week. Until then, take care and go through some of the stuff which I mentioned.
Thank you.
Thank you.